In 2018, the story of a Michigan woman, Hannah Martin, went viral when it was revealed that her organ transplant committee recommended that she raise $10,000 in order to be eligible for the surgery. Public outrage ensued at the idea that the committee had essentially told her to crowdfund to save her own life. Now, many of us in Canada might think, well, that kind of stuff only ever happens in the States. We have universal health care. But in fact, medical crowdfunding via sites like GoFundMe is growing in popularity in Canada. Here's a quick scroll through just a few pages of active GoFundMe campaigns that I found at the time of this video. These are all for individuals in Canada raising money specifically for healthcare related costs. Through this study, I've been learning the stories of people who have created a medical crowdfunding campaign, benefited from one, or contributed to a campaign for personal healthcare related expenses, from paying for prosthetic limbs and gender affirmation surgeries to making up for lost wages while caring for oneself or a loved one. And so far, what I've been hearing from participants is that you don't realize where your personal and social safety nets fall short until you go through it yourself. And this is why their stories need to be told. We often hear about the viral campaigns, the ones that reach or even surpass their fundraising goals. But a 2019 study on Canadian GoFundMe campaigns for organ transplant recipients found that out of 429 campaigns studied, individuals asked for a total of over $11.2 million, but only received about $2.3 million. That's about 21%. The researchers also found that the results were uneven. Some people reached their fundraising goal, while others did not. As of today, there are only a handful of published studies on medical crowdfunding in Canada, and none of them have interviewed users themselves. My research adds to existing studies by centering the stories of those who have lived through the experience of raising or contributing to medical crowdfunding campaigns. Together with my participants, we're exploring the strengths and gaps in personal and social safety nets. As one participant told me, when they say that healthcare is free, they're talking about the hospitals. It's the minute you step out of the hospital. It's not free. As people with lived experience, my participants also discuss what they think are the ideal roles of governments, charities, and individuals in supporting people with healthcare-related expenses. Through this research, my goal is to not only ask questions about how we care for each other in Canada, but how we should care for each other, so that we can work towards building more fair and equitable systems of healthcare and social services in this country.